5 signs an elderly person may be in their final year. Subtle warnings you shouldn't ignore. It is a deeply human experience to witness subtle yet concerning changes in a loved one as they age, particularly over the course of a year. While many people often associate death in old age with suddenness, the reality is that the human body frequently communicates its decline through quiet, almost imperceptible warnings that can manifest months and sometimes even up to a year before life reaches its natural conclusion. The primary challenge lies in the fact that most individuals tend to overlook these initial signs because they appear so minor at first glance. It is only in retrospect, with the benefit of hindsight, that families often realize the clues were present all along, and by then, the opportunity to prepare, both practically and emotionally, and to truly make those last precious memories count, may have passed. This video aims to illuminate 5 key indicators that commonly appear in the year preceding an elderly person's passing. Some of these might be changes you've already observed, but perhaps dismissed as simply a part of the aging process. Others may seem insignificant, but actually serve as signals of the body's gradual, inevitable decline. Recognizing these signs early is not about fostering fear, but about empowering yourself with knowledge. This foresight provides the invaluable opportunity to offer enhanced care, to cherish truly meaningful moments, and most importantly, to ensure that your loved one's final stage of life is enveloped in comfort, dignity, and profound peace. We urge you to stay with us until the end of this discussion, as understanding these 5 signs can be instrumental in preparing yourself emotionally and practically for what lies ahead. When you possess this understanding, you will not be caught off guard. Instead, you will be better equipped to maximize the precious time you have left with those you hold dear. Now let us begin our exploration. The first and arguably one of the most telling indicators that an individual may be entering the final year of their life is significant, unintentional weight loss. Initially, this decline might appear subtle, perhaps manifesting as a belt that suddenly needs to be tightened, clothing that seems to hang loosely, or an appetite that was once hearty begins to wane. Many families might rationalize this as a natural consequence of aging, but the truth is that losing weight without consciously trying is rarely a positive development. It frequently signifies that the body's ability to efficiently absorb nutrients is diminishing, muscle mass is decreasing, and essential bodily systems are beginning to slow their functions. While aging naturally contributes to some degree of muscle loss, a rapid or pronounced decrease indicates a deeper underlying issue. The body may be encountering difficulties in digesting food properly, or the individual might no longer be able to effectively process protein, leading to muscle wasting. This loss of physical strength not only makes movement more challenging, but also elevates the risk of falls, weakens the immune system, and leaves the person more susceptible to infections. Another significant factor contributing to weight loss in the final year of life is a change in appetite. Many elderly individuals simply do not experience hunger with the same intensity as they once did. Their sense of taste may become dulled, food may lose its appeal, and they might begin to skip meals or consume considerably smaller portions. This is not merely a matter of personal preference. It is a physiological shift. The body, sensing that it is beginning to enter its final phase, no longer signals the brain to seek food with the same urgency. The cumulative result is a decrease in energy, a reduction in strength, and a gradual deterioration of overall health. Furthermore, underlying medical conditions play a crucial role. Weight loss is a common symptom of chronic diseases such as cancer, heart failure, or kidney disease, all of which can progress significantly before more obvious symptoms become apparent. Even conditions like depression or cognitive decline can lead to a reduced intake of food, initiating a downward spiral where the body is deprived of the necessary fuel to sustain itself. Some families attempt to address this by encouraging their loved ones to eat more, offering favorite dishes, or supplementing meals with protein drinks. However, if the weight continues to decrease despite these efforts, it is essential to acknowledge that the issue transcends mere dietary concerns. It signifies the body's preparation for a deeper transition. At this stage, forcing large meals may not be beneficial. Instead, focusing on comfort, easily digestible foods, and maintaining hydration can make a more substantial difference in preserving the quality of life. If you observe significant weight loss in an elderly loved one, especially if they are eating less, feeling weaker, or struggling to remain active, it is imperative to pay close attention. This is not simply about physical appearance. It is about the body communicating a profound message. Understanding that message now can provide you with the foresight and compassion to navigate the road ahead with clarity, making every remaining moment meaningful. Transitioning. To the second key sign, we encounter extreme fatigue and weakness. One of the most noticeable transformations in the year leading up to the end of life is a profound and persistent fatigue that is not alleviated by rest. This is far beyond merely feeling tired after a strenuous day. It is a deep exhaustion that renders even the simplest tasks daunting. The act of getting out of bed can become a significant challenge. Crossing a room requires considerable effort, and activities that were once routine, such as cooking, dressing, or even engaging in a conversation, begin to feel overwhelmingly draining. This debilitating lack of energy is not merely a consequence of advanced age. It is a signal that the body is actively conserving its dwindling energy reserves. As organ function begins to decline, the body prioritizes essential functions. The heart's pumping efficiency may decrease, circulation can weaken, and muscles may not receive the same level of oxygenation they once did. This physiological shift is why many elderly individuals in their final months experience profound weakness, unsteadiness, and an inability to sustain the level of activity they were accustomed to. Another critical factor is the slowdown of metabolism. The human body is inherently designed to produce and utilize energy, but as it prepares for its final phase, this energy is rerouted. Instead of fueling physical activity, the body shifts its focus towards preservation. This explains why individuals in decline may begin to sleep more, require longer naps during the day, and find it difficult to remain awake for extended periods. Some may even experience abrupt dips in their energy levels, appearing perfectly fine one moment and completely depleted the next. However, perhaps the most emotionally taxing aspect of this process is the psychological impact of fatigue. Many seniors who once took pride in their independence can begin to feel frustrated or even embarrassed by their inability to perform tasks they once took for granted. This can lead to social withdrawal, avoidance of social interactions, or a cessation of engagement in hobbies, not due to a lack of interest, but simply due to an overwhelming lack of energy. This can foster a cycle of isolation where they may stop trying altogether, inadvertently accelerating the decline. For families witnessing a loved one transition from an active and engaged individual to one who is profoundly exhausted and withdrawn can be an incredibly painful experience. It is easy to fall into the trap of assuming laziness or the need to push through it. However, the reality is that forcing activity will likely be counterproductive. What becomes paramount is understanding their limitations, allowing them to rest when needed, and ensuring their remaining days are as comfortable as possible. If you observe a loved one experiencing deep and ongoing fatigue that is not relieved by rest, interpret this as a significant sign that their body is undergoing a major life transition. This is a time to cherish quiet conversations, create moments of peace, and offer unwavering support without demanding expectations. Ultimately, what matters most is not the extent of their physical capabilities, but that they feel loved, understood, and at ease. The third sign relates to an increase in cognitive confusion or withdrawal. As an individual approaches the final stages of life, one of the most striking transformations can be observed in their thought processes, communication patterns, and overall interaction with their environment. You might notice that someone who was once mentally sharp and engaged begins to experience more frequent forgetfulness, struggles to follow conversations, or appears disoriented even in familiar surroundings. They may repeat themselves, forget names, or lose track of time, even if they never had prior memory issues. These subtle cognitive shifts can emerge months or even a full year before death. This is not simply everyday absent-mindedness. The brain, much like any other vital organ, relies on a consistent supply of oxygen and nutrients to function optimally. As circulation begins to weaken and the brain's oxygen supply diminishes, cognitive function starts to decline. Consequently, the individual may become easily confused, experience difficulties in making decisions, or struggle to recognize people and places they have known intimately for years. In certain instances, they might experience brief periods of mental clarity, known as lucidity, interspersed with sudden episodes of confusion, almost as if their consciousness is flickering in and out. Another commonly observed sign is emotional withdrawal. Individuals nearing the end of life often exhibit a diminished interest in social interactions. You might notice them speaking less, engaging less frequently, or spending extended periods in quiet contemplation. This is not indicative of a lack of care for their loved ones, but rather a sign that their brain no longer processes emotions and social engagement in the same manner. Conversations can become tiring, loud environments can feel overwhelming, and eventually, many seniors retreat into their own inner world. Changes in mood and behavior are also frequently noted. Some individuals may become more irritable, anxious, or easily frustrated. Others might appear unusually calm, detached, or indifferent to matters that once held significant importance for them. This is not merely a personality shift. It is often a consequence of the brain adapting to the body's decline. As cognitive functions slow down, expressing emotions becomes more challenging, and the individual may cease to react to situations in the way they previously would have. For family members, this stage can be particularly distressing. Witnessing a loved one lose touch with reality or emotionally withdraw can feel like a premature loss, even before their physical passing. However, it is crucial to remember that these changes are beyond their control. Rather than attempting to re-engage them in conversations that may prove exhausting, the most supportive approach is to meet them where they are. Speak gently, offer reassurance, and understand that even if they do not always respond verbally, they can still perceive and feel your presence. If a loved one is exhibiting increased forgetfulness, confusion, or a reduced level of engagement, do not dismiss these as isolated incidents. They are often early indications that the body and mind are preparing for the final transition. This is a time that calls for immense patience, the cherishing of quiet moments, and the creation of an environment that fosters a sense of safety, familiarity, and peace. Because even when words become elusive, love and comfort can still be profoundly felt. The fourth significant indicator is the occurrence of frequent infections and slow healing. As the body begins its process of winding down, one of the most discernible physical manifestations is a compromised immune system. You might observe that someone who rarely experienced illness in the past now seems to contract every cold, every flu, and every minor infection that circulates. What were once minor ailments now require significantly longer recovery periods, and simple wounds, such as a small cut or bruise, heal at a noticeably slower pace. These changes are not random occurrences. They are clear signals that the body's capacity to defend and repair itself is diminishing. A primary concern is the increased susceptibility to repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more prevalent as the immune system weakens. Many families may interpret these as isolated illnesses, but when they begin to occur frequently or take an extended time to resolve, it often signifies that the body is losing its ability to mount an effective defense. Even antibiotics, which were once highly effective, may appear less potent. The individual might require stronger medications, longer recovery periods, or multiple courses of treatment for infections that would have previously been minor. This phenomenon arises because, as circulation slows and organ function declines, the body's response to medical treatments becomes less robust. Another often overlooked issue is the development of chronic wounds. If you notice that small scratches, sores, or bruises are not healing properly or continue to reopen, it could indicate compromised circulation. Poor blood flow means that vital oxygen and nutrients are not reaching the skin and tissues efficiently, impeding the healing process. Pressure sores, particularly for individuals with limited mobility, become a serious risk and can lead to dangerous infections if not meticulously managed. What is even more concerning is that infections in the final year of life may not always present with typical symptoms. Instead of a high fever, an elderly person might simply appear more tired than usual, more confused, or exhibit a reduced appetite. In fact, for seniors, a sudden decline in mental alertness is often the earliest warning sign of an infection, preceding other discernible symptoms. This is why recognizing these changes early can make a considerable difference in the comfort and support they receive during their final stage of life. For families, witnessing a loved one endure repeated infections can be both frustrating and emotionally taxing. It is natural to advocate for aggressive treatments, hoping that another round of antibiotics or another hospital stay will resolve the issue. However, at a certain point, the focus often shifts from curing to comforting. Ensuring adequate hydration, maintaining skin hygiene and moisture, and minimizing stress on the body can contribute more significantly to their well-being than another course of medication that may only prolong suffering. The fifth and final key sign involves major changes in breathing or circulation. One of the most definitive indicators that the body is preparing for its final stage of life is a noticeable alteration in breathing patterns and circulatory function. You might observe that your loved one's breathing has become slower or shallower than before. At times, they may pause between breaths, or their respiration might become irregular, alternating between periods of increased and decreased frequency. Some individuals experience a gentle rhythmic breathing pattern known as Cheney-Stokes respiration, characterized by a cycle of deep, rapid breaths followed by prolonged pauses. While these changes might initially be subtle, they tend to become more pronounced and frequent over time. Another common manifestation is weakened circulation. You may notice that their hands, feet, or even their nose and ears begin to feel cold to the touch. The skin might appear pale, bluish, or mottled, particularly around the fingers and toes. This occurs because the body is strategically prioritizing blood flow to vital organs, thereby reducing circulation to the extremities. It is a clear indication that the heart is not pumping with the same vigor as before. Some individuals also experience increased shortness of breath, even with minimal exertion. Simply sitting up, speaking, or shifting positions might leave them feeling winded or gasping for air. If they were once able to walk across a room with ease but now struggle to do so, their lung function may be declining. In certain instances, fluid buildup in the lungs can exacerbate breathing difficulties. This can result in a persistent cough, gurgling sounds, or a sensation of tightness in the chest. While many might assume this is simply congestion from a cold, in elderly individuals nearing the end of life, it often signals a weakening of the lungs. This can make lying flat uncomfortable, prompting them to prefer sleeping propped up on pillows or in a recliner to ease their breathing. For families, witnessing these changes can be frightening. It is natural to want to intervene, to encourage deeper breaths, or to worry about an urgent medical issue. However, in many cases, this is simply the body's natural process of slowing down. While reversing these changes may not always be possible, there are ways to enhance comfort. Maintaining a cool room environment, using a humidifier, or offering small sips of water can help alleviate discomfort. In some situations, medications or oxygen therapy can provide relief, but the primary focus often shifts toward comfort rather than an aggressive attempt to resolve the underlying issue. If you observe these signs, changes in breathing, cold extremities, or a bluish discoloration of the skin, it is crucial to pay attention. These are often indicators that the body is conserving energy and that circulation is slowing down. This is a time to be present, to offer reassurance, and to cultivate a peaceful environment where they feel safe and at ease. In these final months or weeks, the most valuable gifts you can offer are not necessarily medical interventions, but rather comfort, dignity, and the profound knowledge that they are not alone. As we reach the conclusion of this video, take a moment to reflect on the insights we have shared. Significant weight loss, extreme fatigue and weakness, increased cognitive confusion or withdrawal, frequent infections and slow healing, and major changes in breathing or circulation are the 5 key signs that often emerge in the year preceding an elderly person's passing. It is important to remember that these signs may not all manifest simultaneously, nor are they always immediately obvious. However, when you begin to notice them, it serves as a clear indication that the body is preparing for its final transition. For many families, acknowledging these changes can be deeply challenging. It is a natural human inclination to resist them, to encourage a loved one to eat more, to move more, or to push through exhaustion. Yet, sometimes the most compassionate and beneficial approach is to listen to what their body is communicating. Instead of solely focusing on attempting to reverse the inevitable, we can shift our attention to making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs is not about dwelling on the fear of death, but about embracing preparedness. When you recognize these changes early, you are empowered to provide more effective care, to make crucial decisions in advance, and to ensure that your loved one's final months are filled with love and dignity. This is a period for cherishing moments, for sharing stories, and for conveying to them how valued they are and that they are not alone. If you are currently observing these signs in someone close to you, take a deep breath and find solace in knowing that you are not embarking on this journey alone. Many families have navigated this path before, and while it is undeniably difficult, possessing knowledge of what to expect can help you discover the strength, patience, and peace required to move forward. Thank you for joining us today. We sincerely value your engagement and would be delighted to hear from you. Please leave a comment below and share one particular insight you gained from this video and how you intend to incorporate it into your life. Your thoughts and reflections are incredibly important to us, so please do not hesitate to share them. Reading your comments provides us with immense motivation and encouragement. If you found this video helpful and insightful, we kindly ask you to like it, subscribe to our channel, and share it with others. Your support is instrumental in enabling us to continue producing valuable content designed to inform and inspire. Thank you for watching, and we eagerly anticipate seeing you in our next video.